we come to the continuum of care of ECD, that is, it starts not after birth, not even in utero, but before that. That is, right from adolescent phase. And now there are two phases of window of opportunity. The first phase is where the brain is developing, the learning phase around that. But the second phase comes. Here is the phase which is the vulnerability phase. And this is where the brain is remodeling itself. Please remember, adolescence is a phase where you have to be very, very careful. You should not become aggressive to them. You should not always say that you are wrong. We have a tendency to say that they are doing wrong. Agree. They are listening to the peers more than the parents. If their friends are there, or the friends, somebody is there, they will listen to them, but they will not listen to their parents. And sometimes something very bad happens and they learn a lesson on their own. Do not ever talk to them rudely. Do not beat them. Do not tell them they are doing wrong. He's smoking drugs or something. I'll tell you a very good thing. They are smoking, it is wrong. But if I tell him that you are smoking, this is wrong, he will go and smoke somewhere else and come back. And you will see that whole room which is smelling of smoke. But if I tell him, what goes of yours if I'm smoking outside, some arrogancy comes into them. That time you feel so hurt that I have brought up this child, I've done everything and now he is hitting me back. There are ways, I tell you in Bombay, at 2 o'clock in the morning, you will see all these young boys, teenage boys with their motorbike. They speed off. I don't know what goes in their head. They speed on that highway. Who is going more than 80 kilometers, 100 kilometers? Unfortunately, one of my friend's son was one of them at 2 a.m. right. He fell off that highway, he went down. He got a head injury and he died. Now that was a very traumatic thing which happened to 3 of his other friends. They stopped riding on the motorbike. It was a bad experience which happened. But the reason was what I'm trying to tell you, push them into it. We become very possessive, that he's my child, I did all for him and now he's doing wrong. Be gentle to them. Okay, you did this. Why don't you go down on the road? Why you want to do this? It will happen like that. Okay, we will also have somebody. There are ways in which you have to moderate them. Stop smoking, you will smoke. But smoking is hazardous. Smoking is doing wrong to you. Okay, you're doing 10 cigarettes, now come down. Slowly, you have to be with them. And that is a phase, it is not their fault. Please remember, it is not an adolescent fault. This is a phase where hormonal changes take place. Some of the anabolic hormones, they can really push the child to do wrong things. So it is very important that you talk with them, make them understand what is happening during their period, because this is a remodeling of the brain which takes place in this phase. So that phase is a bad phase, but it is not that bad. It is we have to model ourselves to accompany them. So we have adults, we talk of girls for the simple reason that they are going to be future mothers. We have young adolescent girls who are 10 to 40, and then we have 15 to 21. And please remember, both of them have got this problem which can occur. They are anemic, they get married off, or if they don't marry, as you said, they can have child. Mothers take care of their kids, or friends take care of the kids and nurture them and grow them. They are growing, sometimes they leave the child with their parents and go off on their own, but that is how life is with them. Then you have, how do you do education? It's very important to educate every child. Give them education, they can go on to their future life on their own. And that is our fault if we don't do that. So nurturing is very important. Let every child know what is pregnancy, what is menstruation, what is menstrual hygiene. We don't talk to them. I don't know, the parents don't want to talk to them. Let them know what is the cause, what is the effects of it, what is spacing, when you get married, what you should do. If they have knowledge of that, then all problems don't start next time. So if you have a girl who is a teenager, you can see what is the outcome. This is the outcome of a teenager. So who, as you say, is not married. Unfortunately, she was abused. And the person who abused her refused to take care of her. Only reason he did take that she will be a servant in my house. He was married man. He was ready to take care because he cried and all, and mother said, I won't take care. But he was paid to labor in that house as a servant. But was the child sick? She did. Of course, she lost that child. We have to be very careful, provide safe environment, hygiene, use of contraceptive. Please tell them what is unsafe abortion and also it is important, and if you educate them and teach them on the rate, at least this problem of early marriage won't come up, or early pregnancy should not happen.